Evidence-based medicine, asking questions and finding appropriate resources. Practicing evidence-based medicine incorporates clinical expertise that includes in-depth background knowledge and clinical experience, patient values, and research or evidence to inform decisions about patient care. Evidence-based practice is often summarized as the 5 A's: asking questions, acquiring information, appraising the information, applying your expertise, and assessing the outcomes. Evidence-based medicine is practiced by constructing a well-designed question and consulting the appropriate resources. As you think about your patients, you may formulate 2 different types of questions: background questions and foreground questions. The resources you should consult depend upon the type of question you are asking. Ask background questions when you need to know general information. What is the central concern? What is Kawasaki disease? What decisions must be made? What drugs are typically prescribed for asthma? What is uncertain? What is enteral feeding? Ask foreground questions when you have a specific question about a specific patient. Foreground questions tend to be about choices, comparing therapies or interventions, potential harmful outcomes, differential diagnoses, and diagnostic tests, for example. Use the PICO framework for formulating a foreground question and identifying the key concepts and comparisons for which you want evidence. Taking the time to define your questions and determining if you need background or foreground information will help you to locate resources with the level of evidence that is most appropriate to answer your question. The evidence pyramid visualizes the quality and the quantity of available evidence. The resources near the base of the pyramid include medical textbooks, case reports, and journal articles. Search tools such as Access Medicine, Clinical Key, and PubMed to help you answer background questions. Since foreground questions are based upon a specific patient or specific scenario, you want to identify the highest level of evidence to support your decision-making. The resources near the top of the pyramid are filtered or pre-appraised, integrating current evidence with actionable recommendations. Summary resources like systematic reviews may be found using tools like UpToDate, Cochrane Library, and Dynamed. Evidence at the highest level of the pyramid summarizes the range of evidence, recommends current best practice, and provides citations that link you to the original research studies. Links to these resources are available from the Robert Wood Johnson Library homepage, where you can link directly on Access Medicine or PubMed to search for background information, or click on Dynamed or Cochrane Library to locate tools for answering foreground questions. Resources such as JAMA Evidence and the EBM Resource Guide provide you with additional tools such as appraisal worksheets, tutorials, and slide sets to assist you in your evidence-based approach to medicine. Do not hesitate to contact the librarians at Robert Wood Johnson Library for further assistance.